November is Lung Cancer Awareness Month, and if you aren't aware of it already, the truth is that lung cancer kills more American men and women than any other type of cancer, yet sadly it can be detected far too late for many patients to find success. Well, we're going to help you this morning. So happy to have Dr. Krish Bhadra here. He is with the Buzz Standifer Lung Center at CHI Memorial. Good to have you.
Thank you for having me.
You are an interventional pulmonologist, which, as you said, you're a subspecialty of a subspecialty.
That's correct. Interventional pulmonology is a relatively new field within pulmonary medicine. It's basically a multidisciplinary physician who deals with other subspecialists of thoracic oncology. So what we do is we do minimally invasive procedures within the chest, both within the windpipes and in the space between the lung and the chest wall, which we call the pleural space. We also work very closely with medical and radiation oncology and thoracic surgery. Most of my patients, about 90 to 95% of them, have cancer, either lung cancer or cancer that's spread to the lungs.
So you were telling me, and this is a shame, that there is still kind of a stigma associated with lung cancer. What I said is true. It's the #1 cancer killer of men and women, but because often patients have smoked in their past, they feel a little bit of like it's a self-inflicted wound in a way.
That's true. I think that has also held back a lot of the research, but times are changing. There is a big movement within medicine, and particularly thoracic oncology or lung cancer. One of the major advancements is that we have CT screening available for patients.
Okay.
CT screening is the early detection of lung cancer. To give you an example, a patient could start getting CT screens as early as age 55 to 75. And they would simply come in and get a CT screen. It's a low dose of radiation and allows us to be able to detect lung cancer earlier.
So this is part of this team approach that you have at the Buzz Standifer Lung Center, and as such, you have seen these rapid increases in the last 5 years. Your numbers have more than doubled, or right at doubled, in the numbers of early detection, early stage lung cancers that you're finding. Far greater than the national average.
That's correct. We've even received national recognition for our early detection of lung cancer. The national average for detection of lung cancer, early stages 1 and 2, is 15 to 20%. At Memorial, it's 47%. And we've seen a year-over-year increase in the numbers of early stage lung cancers.
These CT screenings that you mentioned, you told me that most hospitals will do about 25 a year.
That's correct.
You're doing 1,000 plus?
We're about 1,000 this year, and we should be heading. We have plans to expand the CT screening program up to about 10,000 patients, which would include most of the patients in Chattanooga.
So how does it work? If someone's watching and they're currently not maybe even seeing a pulmonologist, if they've been a smoker in the past, would they be a good candidate to come in and say, hey, I think I better have a preventive screening?
Anybody who's ages 55 to 77 who have smoked for a substantial number of years is potentially a candidate. What we recommend is that you contact us through a number, 423-495-LUNG. If you contact that number, they'll screen you over the telephone and see if you're a candidate for a CT screening.
If you come in, you had told me before we began talking on the air this morning that one problem with lung cancer is that you don't have nerves in your, you don't feel in your lungs, so those symptoms are showing up later on.
Yeah, so there's not pain fibers inside the lung. So patients often find lung cancer at later stages if they wait without getting screening studies done. The cancer will actually have to grow to a point where it's eroding into a vessel and causes coughing up of blood, causes a cough. It may, if it touches the outer surface of the lung, it can be painful, or even if it spreads, at which point if it spreads outside of the chest, it's unlikely to be cured. So it's in everybody's interest to catch lung cancer very early.
I know that you wish that smoking would just go away entirely, but a lot of people were once smokers who then learned the dangers and now are not. So how many years did you have to smoke? How long could you have quit to then have some peace of mind?
Very good question. So typically we say that you have to have smoked 30 pack years, which essentially, for example, if you smoke 2 packs per day for 15 years, that would be 2 times 15, so it would be 30 pack years or more. And you can't have quit within the last 15 years. Those are the 2 criteria in addition to the age. of 55 to 77.
Okay, wait, you can't have quit within the last 15 years to then qualify for this early CT screening?
Right, but if you're still concerned, you can definitely come to our clinic, and then we can talk about potentially screening you through other modalities or seeing if you qualify for a routine CT scan.
You did mention that the smoking is obviously a great contributor. It is not the only one.
No.
The wildfires that we're seeing here.
Yeah.
People are having a hard time breathing. I know this is small compared to what you're seeing in your office, but if you suffer from any kind of a lung issue, be very careful right now.
I think, yeah, I would probably try and stay indoors and try not to expose yourself to the smoke, especially if you have asthma or COPD, in which you're very sensitive to outdoor smoke. I even find it uncomfortable to be outside for a long period of time, especially when you can actually smell the fire that's ongoing right now.
And what about secondhand smoke? Is that still a problem that we don't address fully?
Yeah, so the #1 cause of lung cancer in about 85% of patients is primary smoking, so actually smoking tobacco products. One of the other main causes is secondhand smoke, so even family members could potentially be at risk. And then another risk factor is radon. And then, of course, there's a lot more complicated exposures that are associated with work exposures like asbestos.
You know, it's once again one of those examples of how lucky we are to live here in Chattanooga. We're this little hamlet that's making great breakthroughs in lots of ways. You came here from Philadelphia 5 years ago to join this winning team. So let them help you. Our numbers are staggeringly positive and hopeful. Come and be part of the success. The Buzz stand for Lung Center, where you'll find Dr. Bhadra on Glenwood Drive, the main campus, of course, at Memorial. They also have, for the Lung Center, a second location, Lung Care Associates, out on Hamill Road in Hickson, whichever is easier for you. And there's the number 495-2635 for you to call and get more information, perhaps make an appointment. Good to see you this morning.
Thank you very much for having me.
We're back after this.